Okay, so I have Professor Harry McConnell with me. I'm David Roland, and so we're interested in taking questions from you to do with disability, brain injury.
Well, the concept is very similar, but this is a different treatment than the type of treatment for blue light therapy for seasonal depression. So seasonal depression, where I come from in America, is actually quite common. Here, where we have sunshine, 12 months of the year, it's much less common. It should be said, but it is a very valid treatment for seasonal depression, and I suspect that it works in a similar way. So I think that's a very good point. It's an analogous treatment to seasonal treatment for depression. And also I think it's important, I'm glad you asked that question, because the symptoms of fatigue and depression overlap so significantly. And it's easy to confuse one for the other. They are different phenomena, but sometimes people who actually present with fatigue actually are depressed, and it's worthwhile being assessed specifically for that, because it may be that not just treatment for fatigue, but actually treatment for the depression, whether that's medication or cognitive behavioral therapy, may actually be the go there as well. It can, that's an unusual cause for brain injury, for Parkinson's. So usually most Parkinson is, most Parkinson comes on spontaneously. Sometimes it can have a genetic underlying, but more commonly it just occurs out of the blue as what's called a neurodegenerative disease. And it comes from under the great auspices of so many neurological conditions of being idiopathic. Idiopathic is, it's one of my two favorite words in all of medicine is idiopathic, which means that we don't know what's going on. It comes from the word idiot, meaning don't have a clue. And my other favorite word in medicine is iatrogenic, which means physician-induced, which is a fancy way of saying in front of the patient, oops.
Without admitting liability.
That's it. So
that's a special medical condition.
But you can, if the brain injury involves the basal ganglia, which is the part that's involved in Parkinson's, you can actually get Parkinson's coming out as a result of a brain injury. Certainly there is good evidence, that you can get Parkinson's if you're in a situation where you've had repeated brain injuries, such as boxers have, they can get a Parkinsonian type syndrome that comes from repeated head injuries that can affect the basal ganglia, that part of the brain to do with movement coordination. What happens with the thermo-regulation? I mean, as you say, the first thing to do is exclude a treatable underlying cause. So that's why it's worthwhile doing the endocrine screens and looking at thyroid, things like that can cause thermodysregulation that will be treatable with simple medication. But in the absence of that, what is the most common cause after a brain injury is that this is a dysregulation of a part of the nervous system called the autonomic nervous system. Okay, so this has two branches. There's the sympathetic branch and the parasympathetic branch. The sympathetic branch is involved in increasing the heart rate, increasing the breathing, getting you ready for sort of fight or flight mode, and the parasympathetic branch sort of slows down the heart, slows down the breathing, and together this part of the brain, the autonomic or automatic nervous system, it's like an autopilot for you, and it takes care of all the parts of your brain that you ordinarily don't need to think about. Well, you'd go crazy if you had to think about every single thing, every single breath that you take, every heartbeat, your blood pressure. So it's the autopilot for your brain. Now, so it's like and autopilots work great when everything's going smoothly. So so if, for example, you've got a pilot who's flying from New York to London. So usually what happens is they go up to a certain altitude, they take off from LaGuardia, they go up to a certain altitude. They say, okay, I'm going to go in the back and take a kip. Wake me up when we're over Heathrow. So then they flick on the autopilot, everything's smooth, and ordinarily they're supposed to wait till they get to Heathrow. And then, but if there's a volcano in Iceland, somebody needs to go wake him up sooner. He needs to come back, flick off the autopilot, and he needs to take control of those things that are usually automatic, steer through the ash of the volcano. Everyone then arrives safely at Heathrow. They go, they see the jewels, they see all the sights, the British Museum, the tourist industry booms, the economy is good, everyone's happy. So So life is full of Icelandic volcanoes, okay? And so that's the type of thing that sometimes people need to actually learn to take back control of that sort of autonomic part of their nervous system. Is flicking off that autopilot, taking control for themselves of those parts of the brain that ordinarily take care of themselves. And you can learn to do that. You learn to do that through things like mindfulness techniques, meditation, Tai Chi, through biofeedback. So with biofeedback, for example, you can actually learn to control specifically your sympathetic and your parasympathetic. So you can learn to control very easily. Sometimes with patients I will do temperature biofeedback, where they can learn to control you can learn to control the temperature of your finger. You can learn to increase it or decrease it by 10 or 15 degrees by what you think, by what you're visualizing, okay? And so it's a very powerful tool, and it's part of, and you do that with visualization, relaxation techniques. It's a very similar technique to what you do with lie detector tests, okay? So there's in the Gold Coast there in Canunga, there's a black ops school, I understand, for ASIO. They do all sorts of terrible things there that I really I don't know anything about at all. But one thing they do that is very interesting is they teach people how to trick lie detector tests, which is not difficult. And lie detector tests, essentially, they measure the electrical resistance, which is the reflection of the blood flow and the sweat going through your finger, which is the autonomic nervous system. So they teach you how to trick a lie detector test, and by doing that, what you're doing is you're actually learning to control your autonomic nervous system. So it's very similar technique. So you can do that through meditation, Tai Chi, mindfulness. You can do that through biofeedback. There's lots of different ways to do that, but that's the underlying mechanism behind the temperature dysregulation that you get. It's a problem with that autonomic nervous system.
Yeah, and I guess the principle here, Harry, is you're taking something that's normally unconscious.
Yeah.
As you said, it's a thing that's happening every moment of the day. You don't normally have to think about it, but when you get the Icelandic volcano,
yes,
something goes wrong, that's when you bring the conscious attention to it.
That's it.
And then there's different strategies for doing that, and one of those is neurobiofeedback as well, isn't it?
That's right. That's another.
Which is actually quite a new area. So you're learning to take conscious control of parts of brain function or nervous system function, which normally you wouldn't need to bother about.
That's right. That's exactly it. It's great for mood, it's great for anxiety, but it's also can be good for this autonomic dysregulation, which can include, that autonomic dysregulation can cause lots of different problems. It can cause blood pressure problems, it can cause temperature dysregulation, but it can also cause things like a persistence of pain. So some of the pain syndromes can relate to that as well.
And what I would add there, Margaret, is that mindfulness or mindfulness meditation, one of the things that it definitely does, in my experience, and this is certainly backed up by research, it improves your attention, your focus of attention. So people that practice those types of things, like mindfulness meditation, learn better because they can focus better, they can concentrate better. And my own experience is that I became much more in tune with my body. And I mean that in a physical sense, in a cognitive sense, what I'm thinking, and also what I'm feeling. So certain things might trigger me, might make me feel angry, but what I would notice now is that early trigger. I think, oh, there's that sensation. So then I can respond differently. I've got an option now to respond. So it's a bit like it's a searchlight in your body. And I think what Harry's suggesting is that any practice, and that's a good practice, that gets you much more in touch with what's going on internally, physically and mentally, is going to give you a head start in terms of making some changes to the ways you do things. But I think neurofeedback or biofeedback might be an additional thing for you to look at. My own experience with music was that, so I've always played music, but after the stroke, I stopped playing music and stopped listening to music. And I think it was just part of that withdrawing and it just didn't seem important at that point, and it was trying to reduce stimulation. And what's been really, but then I learnt that music making, playing an instrument, activated a lot of the areas of the brain, and the reason that it does that is music's got a lot of components to it. when you think about it, it's a very complex process. It's got rhythm, it's got tone, it's got melody, and it's got emotion as well. Like you hear somebody play music without emotion, gets all the notes right, and someone that really puts emotion into it. So it's a very comprehensive activity, and it requires different areas of the brain or different networks to synchronize together. And so that's a very good brain training program. But it was interesting, I noticed I lost all interest in listening to music. But in more recent times, in the last 12 months or so, I've been composing a lot of music and just listening to a lot of music. I think when I had the breakthrough and I was able to go back to a music festival and handle lots of music and crowds, I just felt another door opening. And so my creativity around music is far ahead of what it was when I was a teenager. So there's another door that's opened. My stroke was 6 years ago. Yeah. So I've been giving age labels to people's brain injuries. So I think if you're under 2 years post brain injury, you're still in your baby phase. I think post 2 years you're a toddler. And I reckon I'm in the early teenage years at the moment. So I've had people come to me and say, oh look, I don't think I'm getting any better, or I'm at C. And when I ask them, you know, how long has it been? And they say anything less than 2 years. And I say, well, you're still finding your walking feet. You're still learning to walk. It's a very slow but patient process, isn't it?
It's worthwhile, if you don't mind sharing,
Yeah.
I think, your initial story when it first happened and the problems of actually getting the right diagnosis and so forth. That's a compelling issue as well, I think.
Yeah. Well, I won't spend a lot of time on that so we can take questions, but what happened is I was misdiagnosed because I'd had a history of post-traumatic stress disorder from my work. And so when I entered the general hospital, they didn't have an MRI machine in the hospital. I was suffering acute amnesia, disorientation. I could still speak and I could still walk. So they thought maybe I'd had a psychiatric illness, which they called psychogenic fugue, which is just loss of memory due to a trauma or stress. It's a fairly rare disorder. But it was, fortunately, so they sent me to a psychiatric unit, and I thought I completely lost my mind. And so fortunately there was a psychiatrist within that unit who said, well, I'm not sure we've ruled out all the neurological possibilities yet. He even told me later that I could have been a case of malingering, you know, just putting it on. But he said, I didn't think that for very long. So he did a 24-hour EEG to see if I had any epilepsy, that type of thing. But he also ordered a brain MRI. No one had thought to actually do that at this point. And it wasn't until I was discharged from the psych unit and I went to an outside radiology unit that the brain MRI very conclusively showed I'd had a stroke. And so since I've written my memoir, How I Rescued My Brain, I've heard a lot of other stories of people being misdiagnosed or not diagnosed for quite a long time, sometimes months, because these neurological disorders can show up in different ways. I don't know if it's particularly stroke or brain injury.
Yeah, it can happen with stroke, but it can happen with any type of brain injury, because if the part of your brain is the part of the brain that has to do with movement, and you have a paralysis, for example, well, then that seems fairly straightforward to most people. But much more commonly, if the part of the brain that is injured, whether it's a stroke or a traumatic brain injury or whatever, is a part of the brain that has to do with memory and emotions, such as the temporal lobe or the limbic system, which is the oldest part of the brain. And this is a part of the brain that's involved in our basic functions for survival. So it has to do with our fight and flight reflex. It has to do with our ability to survive as individuals and as a species, for reproduction, for feeding, and all of our emotions are wrapped up in this. So if that part of the brain is involved in an injury, it most commonly presents with psychiatric symptoms. So that's where there's frequently disruption, I suppose. Is the problem is that there's not always good communication between different specialists and medical practitioners.
Yeah, and see, I think that type of injury is not only difficult for the health professionals involved, it's difficult for those people around you, your family and community, because you can sound and look completely normal. And I had tremendous amnesia, so I could walk down the street where I live, but if I was in a new place, I couldn't walk down the street and be sure that I'd know how to get back there again. But yet I was walking normally, and I would have appeared normal. And of course I could still speak, even though I knew I was really struggling with conversation. It felt like, to me, I was speaking English as a second language. I'd have to really think, what is the word for that thing? And then, you know, produce it. And so to people that didn't know me, I appear completely normal. And if you've got that type of invisible disability, of course it throws up challenges when you're in new places and people don't know that. And you have to explain, well, I can't sit here for too long because it's too noisy or whatever. Yeah. I mean, my own experience of that is that you have to withdraw for a while. You know, like when you get injured physically, like, you know, properly injured, you just want to curl up and rest, don't you? So it seems a natural biological mechanism which is built in us to take care of ourselves. So I think that's happening mentally in a sense as well, because the brain is a biological organism, it's an organ, so it's trying to heal. So it reduces stimulation. And my experience was that sound was just flooding me. It was just too much. It actually hurt my brain. And I don't know what the neurological mechanism is for this, but my brain actually hurt. But there's no pain receptors in the actual brain tissue itself, other than the arteries. But it wasn't like a headache. It was like my brain had expanded and my skull was too small, and so it was like pressure, and it was all over. So I would just want to withdraw from anything, any noxious stimuli that was bringing that on. But I think what happens, and I can't say exactly what point this was, is I just didn't want to stay like that forever. So there was a part of me that after a while had enough self-protection, thought, well, I want to move beyond this just being closed in. And it's partly my personality, I guess, but partly realizing that there was so many wonderful things that I was missing out on, or that I wanted to engage with again. But as a carer, I'm not sure how you judge that. Because as a carer, you can see that a person to re-engage again might be good, and you can make suggestions about the type of re-engagement. But at the end of the day, you have to go by what that person says is okay and not okay. But I think mostly a person wants to get back to how they were, so they're going to feel motivated at some point to retry, and you can just offer opportunities.
Well, there it's really good to get linked up with a vocational rehab specialist, because you know, sometimes it's not about going back to the work that you were doing previously, but sometimes it's about thinking creatively about other types of work that you can do. So vocational rehab specialists are really, really good at helping people to either retrain in different areas or think creatively out of the box about different things that they might be able to do, because working is a great thing, and you know, the only thing worse than working is not working, you know, so it's really an important thing to do, to get back to work if you can. So I would encourage you to work with your rehab people with that.
I might mention one writing strategy that I discovered, which helped me and was helpful for other people. Is writing a gratitude letter. So, you know, I said that gratitude seems to have increased for me. Gratitude for the people, the marvelous health professionals that I discovered, and some that I didn't think were so marvelous, and just friends and other people that helped me. And so writing a gratitude letter is simply thinking about one person that you want to say thank you to. And then in this letter, just saying the positive things, what it is that you're grateful to them for, like specifically writing those things. And it's a letter that you work on, so it wouldn't be more than one page. And once you've got it how you want it, if it's really nice, can be very moving. If that person is still alive, you can do a gratitude letter for someone that's passed, is to go and read that letter to them. And it's a wonderful thing. And I did that with my father before actually I had the stroke. And I still feel this welling of gratitude to him whenever I think of sitting with him and reading this letter to him.